Hello everyone, I'm Pharmacist Michael, and today I'm going to talk to you about another drug by the name of Depakote, which is divalproex sodium. So what is Depakote for? There's four main things. One is different kinds of seizure disorders. Two is for mania associated with bipolar disorder, bipolar 1. 3 is migraine prophylaxis. And 4, it can be used for neuropathy in diabetes. So that's what Depakote is used for. Those four things primarily. How does it work? Well, I'm going to make this as easy on you guys as I can. First of all, we don't know exactly how it works, but we think it somehow increases GABA, which is an inhibitory neurotransmitter. So this neurotransmitter blocks or inhibits some brain signals, and we think that's how it works for seizure disorders specifically. Okay, what are the contraindications? Who cannot take this drug? One of the most interesting things I find about Depakote is it is one of the only drugs that I know of that has different pregnancy categories. So it's category X, or totally forbidden, in pregnant women if it's being used for migraine prophylaxis. But if it's being used for seizure disorder, it's a category D. Now, category D still isn't good, but it's better than X. Category D means that the positive effects of the drug must outweigh the chances of fetal risk. So you'd have to have a pretty significant seizure disorder to stay on Depakote if you were pregnant. Other people that can't take this drug are people with liver disease and people who are hypersensitive to Depakote. So if they're allergic to it, right? That's pretty much contraindicated with every drug. If you're allergic to it, obviously we don't want to give it to you. Also, people with urea cycle disorder shouldn't take Depakote. Okay, fun part. Side effects of Depakote. I have to say that Depakote is one of those drugs that has been very well marketed by the drug company that makes it. Okay, so we've used off-label Depakote for all kinds of things too. That being said, this drug has a lot of pretty severe side effects, and I'm going to run through some of the big ones with you. It causes hair loss in 6 to 24% of the people who take it. It comes with significant weight gain. 70% of the people who take Depakote will gain at least 5% of their baseline weight. So if your baseline weight for every 100 pounds, you're going to gain 5. If you weigh 200 pounds, that's 10. 50% are going to gain 6 to 8 kilograms. That's 13 to 18 pounds. So it comes with pretty severe weight gain. It causes rash in 6% of people, and some of these rashes are severe Stevens-Johnson syndrome, something we call DRESS. Can be very, very bad rashes. 29% of the people that take Depakote will become nauseous. 18% will have vomiting, diarrhea in up to 23%, and constipation in about 10%. So it has a lot of GI side effects as well. Depakote is toxic to the liver, and in some patients, although rare, it can cause liver failure. So we have to be sure to monitor liver function tests and enzymes while the patient is taking this medication. It causes pancreatitis in about 5% of patients, and it can also cause hyperammonemia. And this is where you get too much ammonia in your blood. Now, when patients come in to the emergency room and they're lethargic or they sleep too much, there's changes in their consciousness, they're confused, disoriented, or have hand tremors, the first thing we normally do is check their blood for their ammonia levels, because if they're on Depakote, there's a chance that there's too much ammonia in their blood. And ammonia is toxic, right? So it can cause all of these things to happen. Some other things that it can cause: low white blood cells or thrombocytopenia. It can cause ataxia, which is problems walking, blurred vision or double vision. It can cause dizziness and sedation. Okay, so that's a rundown on Depakote. Now, I named this video Depakote, the good, the bad, and the ugly. So we're going to go through those three things. What's good about Depakote? Well, for some things it works pretty good. It's pretty good for seizure disorders in certain people with certain types of seizures for sure. It's very good for bipolar disorder, especially manic patients. And really the only thing that's been shown to be better is lithium. But if you have bad kidneys, you can't take lithium. So Depakote is used in a lot of patients for bipolar disorder. It can also stop migraines in some patients who are suffering from migraines. If they get too many migraines a month, we put them on something prophylactic. Now, I wouldn't start with Depakote, but if the other drugs that we have don't work, amitriptyline, Topamax, drugs like that, then Depakote, if it works for you, that can change your life. That can change your life if you are suffering from migraine headaches. Now, as far as the pain goes from diabetic neuropathy, I think there's better drugs for that. Cymbalta would be one. Gabapentin and pregabalin would probably be better for that. Even turmeric I would try before I put somebody on Depakote. The bad is there's too many side effects, right? There's a whole bunch of side effects for this drug. And there's a huge range from neurologic side effects to skin rashes, all the things that we just went through. That's what's bad about this medication. And the ugly, and I'm just going to say this because I work on a geriatric psychiatric unit, this drug should never be used for behavioral and psychological symptoms of dementia in elderly patients, period. And the reason for this is because Depakote makes their brains shrink even worse than they already are. So it makes dementia patients worse. Now, for a long time, psychiatrists were using this drug because it calms people down. Well, the reason it's calming them down probably is because they feel so crappy after they take it. It causes somnolence. They don't want to move around because they feel like crap. Right? I had a psych patient who was younger tell me one time that Depakote makes me feel like I have a wet blanket wrapped around me and I can't really move or do the things I want to do. He said that he felt confined by it. So that's the other ugly thing about this drug is even though it works really well for bipolar patients, some of them don't want to take it. And because they don't want to take it, they stop taking it. And then where do they end up? They end up in the hospital with us, right? Most patients that get admitted to a psychiatric facility, if it's not their first time, are there because they don't take their meds or they stop taking their meds. So that's the good, the bad, and the ugly of Depakote. I hope you've enjoyed this video. If you know anybody that takes Depakote, or anybody that's thinking about taking Depakote, or just somebody who might be bipolar or interested in this drug, please send this video to them. Please subscribe to my channel for more health and wellness information. I will be doing many more videos on drugs. If there's a drug that you want me to cover, please either send a comment on this video or just email me at michael.brown@sunshinentc.com, and I will see that drug gets covered. I'm Pharmacist Michael. Be happy and be healthy.